All right. Cranial nerve one, motor or sensory?
I have to write it out. The mnemonic, yeah. Some
All right.
say
So
so
what is
sensory. Yeah.
okay, so just tell me what it is. So it's
Huh?
smell, right?
Smell,
So
yep.
smell.
Yeah.
Smell has to be sensory,
Right.
right?
Yeah.
Olfaction. We're talking about the cribriform plate. That's where cranial nerve
Hmm.
one sits. Okay.
Okay. Okay.
Cranial nerve two. Is it motor or sensory? What is it?
It's optic nerve.
Okay. So is it
Yeah.
motor or sensory?
Sensory.
Good.
Yeah.
Now, when you say sensory, what kind of sensory? What does it pick up? What is it sensing? Is it sensing the touch?
No, it's more of a visual, like light.
Light,
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 yeah. Light, yeah.
light. We're talking about our pen light. We use it all the,
Right.
I mean, we
Yeah, yeah.
use it all the time, or at least we're
Uh-huh.
supposed to, right? Come on.
Yep.
So that's when we talk about the pupillary reflex, you know
Yep.
why we test it? It's because you carry a stupid ass pen light everywhere you go in the
Mm-hmm.
hospital. So
Yep.
that's the pupillary reflex. You're literally doing this, okay?
Okay.
So, okay, I like to put three, four, and six together. Are those motor or sensory?
Um, Motor.
Motor, very good.
Yeah.
We'll call those extraocular muscles of the
Mm-hmm.
eye. Okay.
Okay.
Now, since we're here, let's talk about that pupillary light reflex or pupillary reflex.
Okay.
Whenever you do reflexes, you do S and M, sensory and motor.
Okay.
Okay. So,
Mm-hmm.
what's the sensory component of the pupil reflex?
Sensory, I'm gonna say optic nerve.
Very good, two.
Yeah.
And what's the motor component?
Motor is three.
Three, right.
Yeah.
So when you shine a light in the eye,
Mm-hmm.
cranial nerve two will pick it up,
Mm-hmm.
pick up the light, and cranial nerve three carries the parasympathetics that will cause the eye to constrict.
Mm-hmm.
The sphincter pupillae muscles cause the eye to constrict. Very good.
All right.
Okay, so let's talk about three a little bit. What happens if three gets knocked out? What happens? Okay, so tell me what happens if you knock three out.
You have the nerve three palsy, which is like uh, uh petosis, something like that.
Okay, yeah.
Yeah.
So the palsy. Tell me about what position will the eye be in?
Um, Down and out.
Very important. There, this will be
Yeah.
on your test. Down and out.
Uh-huh.
Okay. What
Yep.
was the other thing you said? A ptosis? Yeah, I think
Petosis, yeah, like that.
yeah, ptosis. The muscle specifically is the levator palpebrae.
Mm-hmm. Okay.
Okay, ptosis. Now, one last thing. What happened here? What if we knock that out
So
when you shine a
the mydriasis.
mydriasis, the blown
Yeah.
pupil? Yeah.
Mm-hmm.
So, very easy test question.
Mm-hmm.
Guy gets hit on the side of the head, epidural hematoma. Anytime you
Right.
have a herniation, the first cranial nerve you're worried about is three. They
Yeah.
say the patient's eye is down and out.
Mm-hmm.
He's got a ptosis. Question is, what else would you expect? Mydriasis, right? One of
Mm-hmm.
the three. This
Right.
is literally, if there is one thing that you asked any medical student about cranial nerves,
Yeah.
this situation is what gets tested. They love this. All right. This
Mm-hmm.
combination of things. All right. Because
Okay.
herniations happen. And literally, if you can imagine the brainstem, like cranial nerve three is at the junction where the brain gets fat. Right.
Mm-hmm.
So when it
Right.
goes, herniates through the hole, it literally pinches on three. Like it literally. So
Right.
that's the, okay. So that's the story of three. Right.
Mm-hmm.
Very good. Okay. So tell me, what is the mnemonic for four and six?
Oh yeah, the SO4, LR6, everything else is three.
SO4
LR6.
LR6. Very good. So
Yeah.
for cranial nerve 4 does what? What muscle is this?
Superior oblique.
Okay, good. And then, okay, so let's talk about four. The story of four is patient has trouble seeing while going downstairs.
Hmm.
This is how they ask the question. So you can
Okay.
imagine the eyes are primarily looking down.
Hmm.
Okay. Um, so let's talk about, so when you look at the eye, the rectus muscles just pull in the direction you would expect, right?
Hmm.
So
Right.
superior rectus pulls up, inferior rectus pulls down, medial rectus pulls in, lateral rectus pulls out, right?
Hmm. Right.
What's weird is the obliques. Okay, so it's not as intuitive as you would think. The
Hmm.
superior oblique actually helps you look down. It also helps you abduct outward.
Hmm.
Okay, so it's
Okay.
down plus abduction. Whereas the inferior oblique will help you look up and also abduct. Okay. So the
Hmm.
superior oblique helps you look down primarily. Inferior oblique helps you look up. Okay. So when they talk about SO4 problems going downstairs, that's because SO4 helps you look down.
Hmm.
Okay. So
Right.
that's the story that they'll put for the trochlear nerve or the cranial nerve 4. Cranial nerve 6, what's the name of cranial nerve 6?
Or lateral, or the abducens. Yeah.
Okay, and what happens if you have an abducens injury?
You cannot abduct the eye. So,
Right, cannot abduct. So what position is the eye in?
I'm gonna say medial.
Medially deviated. Yep.
Yep.
Okay, let me think
Mhm.
if there's anything else I want to add about the eye. Okay, yeah, there's one more situation. We talked about here the levator palpebrae,
Hmm.
and that helps. You can get a ptosis because the levator palpebrae helps to open the eye.
Hmm.
There's also another muscle that helps to open the eye called the superior tarsal
Hmm. Okay.
muscle. Okay. It's controlled by the sympathetic chain. Now, why am I bringing this up? Horner syndrome.
Hmm. Okay.
Okay. It's in your notes. It was covered. So we should cover it. So what is the triad in Horner syndrome?
I think it's the same as cranial nerve 3,
So
right?
you do get the ptosis. So
Yeah.
what that means is if they give you a question with the ptosis in it, you can't jump on the cranial nerve 3 right away.
Hmm.
Okay, so what's the other two components of the triad in Horner syndrome?
Um, oh, the probably I'm gonna go with the meiosis.
Very good, right? So you're
Yeah.
knocking out the sympathetics. So meiosis. So that's
Right.
very different from that,
Meiosis.
right? From mydriasis. So that'll tell you one or the other,
Hmm.
right? Because
Yep.
if you knock out cranial nerve 3, you're knocking out the parasympathetics. Unopposed
Right.
sympathetics will cause mydriasis. In
Hmm.
Horner syndrome, you're knocking out the sympathetics. Unopposed parasympathetics gives you meiosis. So that
Hmm.
tells you right away. What's the third part of the triad? You knock out
Yeah.
sympathetics,
I'm not sure.
you can't sweat. So
Hmm.
anhidrosis. All right. So,
Okay.
but if you saw that in a test question, you would pick up on it. So no big deal there. Okay. I think that's
Okay.
really all. Be careful with the way they word the questions. Okay. The
Hmm.
way I teach the eye is that I teach the way it actually goes.
Hmm.
Okay.
Right.
The testing component is slightly different. Okay. So whereas when I teach it, the inferior rectus, excuse me, the inferior oblique primarily, like I said, it helps you look up and out. So the vector's this way, right? You appreciate that,
Hmm.
that the vector here between these
Yep.
two, the
Yep.
combined vector would be here. So
Hmm.
that's the way the inferior oblique actually pulls. It abducts and it goes up. But if you were to test, and the thing about the testing is it's not completely intuitive. It's like, how can, it's just arbitrary, but it's like,
Hmm.
how can we arrange the eye in such a way to where we can isolate and test a single muscle? It's very
Hmm.
difficult because you have six muscles. So
Right.
it's like we have to pick a direction to where we can say this is definitively this muscle. Okay.
Hmm.
So when you do this, so be careful. The way I test it, the way I teach it is learn what's normal and then just know that the testing is to flip it.
Hmm.
Okay.
Okay.
So normally the inferior oblique will help you look up and out, up and abduct. The superior rectus obviously looks up and it does have a bit of an adduction to it, kind of because it
Hmm.
has inferior rectus. And so just appreciate this. But when you do the testing, they are flipped. Inferior oblique, when you test it, you test the inferior oblique by making the patient look up and in.
Hmm. Okay.
Okay, and just trust me on that because just they figured this out, right?
Hmm.
It was just
Yeah.
it's not like you can go in, but it's not like one of those things where you can go in your head and be like, okay, wait, if I do this,
Hmm.
it's just one
Right.
of those silly things you have to just appreciate. So if you're going to test the inferior oblique, you're going to look up and adduct. Okay, so the
Uh,
way I teach it is don't try to learn both because you're going to get messed up in your head.
right.
learn one learn
Hmm.
one, which is I just say learn normal, and then just say when if they ask testing to flip them, flip the
Hmm.
top two for testing and flip the bottom two for testing. Let me show you. So this one is superior oblique again. Now down and out. Superior oblique is
Hmm.
helping to look down and abduct. Inferior rectus is a little inward. Okay, so that's the normal way, right? So this is
Hmm.
abduction. I want to put AB. That means we're looking out. So this is
Yeah.
AD. So we're looking in. So the nose is here, right?
Right.
But let me put in the same color. Okay, so but if we were doing the testing, we flip the bottoms and the tops.
Hmm.
So inferior rectus, you would tell the patient to look down and out,
Right.
and yeah, superior oblique, you look down and in. All right. So,
Hmm.
and let me just like be careful because for lateral rectus and medial rectus, it stays the same.
Hmm.
Lateral rectus is the test is to, I'm sorry, the normal way is to look out, and the test is to try to look out. That would make sense. The medial
Hmm.
rectus is the test is um I mean the action is to look in and the test
Hmm.
is to look in. So
Okay.
both the action and the testing does not change for these two. What you
Hmm.
have to do is you have to change, you just have to flip the tops and flip the bottoms. All right.
Hmm. Okay.
I know it's weird, it's stupid.
Yeah, that's
You don't your
yeah.
patient's not going to go, can you explain this shit to me? You know what I mean?
Hmm.
It's not one
Yeah.
of those, right?
Yeah.
Just bear with it. This is the best way I can do it. So learn normal, which is
Hmm.
the black, right? And
Right.
then just for the test, know that you flip the tops and flip the bottoms if they ask testing. Okay.
Okay.
All right. I think that's all for the eye. You feel comfortable with this stuff?
Yeah.
You
Yeah.
pupil reflex. Okay, let's move on to the facial stuff. Good. I feel good about that. Okay. Yeah, and just be careful about the ptosis. Don't jump on
Yeah.
three. I know everybody's thinking three because levator palpebrae, but if it's Horner syndrome, I could see them putting both of those questions on there
Hmm.
just because they
Right.
like the ptosis, right? That's a real life
Right.
thing.
Yeah.
Myasthenia gravis can also cause ptosis, right?
Hmm.
Later in the
Right.
day, patients get tired that they actually get a ptosis. That could be
Hmm.
one of the first signs of MG. Okay, so
Okay.
we need to talk about five now. What is cranial nerve five? Motor
Trigeminal.
syn.
Yeah. Trigeminal.
Yeah.
So yeah.
What is it? What is
All
it?
right. We got V1. V1 is sensory.
V1 is
Yeah.
sensory.
V2 sensory,
Okay.
and V3 is both.
V3 is both. Perfect. So we know it does sensory to the mandible. What is the motor component of B3? What are we doing?
Or the muscles of mastication.
Yeah, so chewing
Yeah,
muscles, right?
chewing. Yep, yep.
So keep in mind now, we know this is just bare bones as it could be. If we're going to talk about moving muscles of the face, you have two options and then a tiny exception.
Hmm.
If we're talking about muscles of facial expression, that's facial nerve. If not, we're talking about the muscles of chewing. That's it, right?
Hmm.
You're either making facial expressions or you're chewing. The only exception is the ones we talked about with lifting the eyelid.
Hmm. Okay.
Okay. Now, be careful how they phrase the question. If they say close the eye, that
Hmm.
is seven. That is an action of
Hmm.
facial expression to
Hmm.
close.
Right.
What we talk about with the ptosis is the inability to keep it open. That's
Hmm.
three, or the sympathetic chain. Okay.
Okay.
So here we're talking about the muscles of chewing or muscles of mastication. Um, so you have the lateral and medial pterygoids, the masseter, and the temporalis. Remember, the lateral pterygoid is the one that um, is
Keeps
going
the
to
mouth
open the
open.
mouth.
Yeah.
Yes, right. Okay.
Hmm.
Okay. So let's see. Seven. Let's do seven then. Okay. So seven is what?
Motor.
Motor, sensory, or both? Actually, both.
Huh. Okay.
Okay.
Oh yeah,
It does.
the
It's a
special
little
special
tricky.
sensory, I think.
It does have special sensory. Yes.
Hmm.
So when we talk about motor, we're going to talk about expression, right? Facial
Hmm.
expression. All right. Um, the sensory component, yeah, generally we're talking about a special sensory,
Hmm.
and we're talking about taste.
Yeah. Two-third, I think. Right.
Yes,
Okay.
anterior two-thirds, right?
Two-thirds. Yeah.
Now, what branch is that?
I'm gonna go with lingual nerve.
Nope. We'll go back to that. I missed that one. What's the other one?
Okay.
Goes through the ears. Comes off of seven. Goes through the ear. You know it. Chorda tympani.
Sounds like it.
Yeah.
Yeah.
Chorda
Yeah.
tympani.
Yeah.
All right. Chord timpani. Okay, so let's go back to this. There is a branch of five that goes to the anterior two-thirds as well. That's the lingual.
Hmm. Okay.
Now, what's the difference between the lingual and the chorda tympani when we say anterior two-thirds? What does this nerve do, anterior two-thirds?
Looks like motor.
No, so it's general sensory. So in when we talk about the general,
Sensory.
when we talk
Uh-huh.
about the lingual nerve, we're talking about textures, right? Right. So like,
Hmm.
or whether whatever's in your mouth is a liquid or a solid, right? So we're differentiating general sensation on the anterior two-thirds,
Okay. Okay.
whereas the chorda tympani is going to do taste, special
Mm.
sensory. Okay, so they're completely separate. They travel together, but they're separate. Now,
Hmm.
there's another very important thing we need to talk about seven, and this is where the question comes in. What else travels with the chorda tympani?
Parasympathetic.
Very good. Yes.
Yeah.
What nerves do parasympathetics travel with?
Um, what nerves? Oh yeah, it's uh 3, 7, 9, and 10.
Perfect, right? And what was the parasympathetics of three that we talked about?
The ptosis and stuff.
Uh,
Yeah.
No, not the the ptosis was the muscle. What is the parasympathetic part of three?
Oh, the what's it called? The pupil dilation stuff. Yeah,
Yeah,
I
constriction.
remember them.
Yeah,
Yeah.
I threw you back into the eye stuff.
Uh-huh.
Yeah, right.
Yeah.
Good, good. Very good. Okay.
Yeah.
So now we're talking about the parasympathetics that travel with seven.
Mm-hmm.
Nothing to do with dilation. We're thinking more of glands.
Mm-hmm. Right.
Okay. So what
Sublingual.
sublingual and what
So
else?
some mandibular.
Okay.
Mm-hmm.
Perfect. Now, the test question, and in real life, nobody's really going to come up and be like, yo, doc, I can't taste on the left side of my anterior two-thirds of my tongue.
Mm-hmm. Yeah.
But what they will do is they will come in and tell you they have a dry mouth,
Mm-hmm.
right? It's like their glandular secretion is a problem. So
Right.
appreciate that. Yeah, everybody knows taste anterior two-thirds, it's ipsilateral, whatnot. But the question's really going to come in here. Okay. Now,
Mm-hmm.
there's also another parasympathetic branch of seven that you should know. It's the one that branches off first in that picture that
Oh,
we
the greater petrosal.
very good.
Yeah.
And what does it do?
Um, I
Think about this, but higher up. Think about this. Same principle.
it doesn't go to the prod,
Don't
right?
make me, no, but don't make me
That's it.
cry. Don't make me cry, Rocky.
Oh, the okay, lacrimal.
There you go.
Mm-hmm.
Now you're not gonna forget. You never make
Mm-hmm.
me cry,
Yeah.
bro. Come on. Okay. You
Yeah.
think. What else do we okay, let's talk about the reflex. Now the reflex we deal with here is the corneal reflex.
Mm-hmm.
Now, whenever we write reflexes, we write sensory and motor. Okay. So what's the
Yeah.
sensory part? What are we talking about with the corneal reflex? What are we doing?
Touching the cornea with
Yeah,
something. Yeah.
actually, yeah,
Mm-hmm.
hopefully not your finger. Use
Not
a
finger.
cotton
Nope.
tip.
Yep.
Okay, what's the
Yeah.
sensory part of it?
V1.
Uh
So V1 or
yeah,
V2?
V2. I think shit. Pretty sure V1. I mean, they just write it as V. I'm pretty sure it's V1. You double
Okay.
check me on that, but yeah, I think you're right because it closes. Yes, it should be V1. But we can just say V for now. Or
Okay.
five. Yeah, it has to be V1. But okay, and then what is the motor component of closing the eye?
7.
Seven. Perfect.
Yeah.
All right, now let's play a little game. Left eye, right. Oops. Um, Let me do this. I can do it here. I like to show. This is how I actually do them when they give them to me. When we do the one touch, when we touch one eye and all this nonsense,
Mm-hmm.
this is how I build it when I
Yeah.
do these questions. I put the eyes and I also do sensory motor
Mm-hmm.
on each side. And I do what I fill in what I can.
Mm-hmm.
Now, you touch the left eye and only the right eye closes. Tell me what you know. Go with the motor stuff first. Tell me what you know. What closed? What can we
Uh,
clearly? You touch the
so
left eye and only
uh
the right eye closed.
so 7's working for the right.
Fine. We check that off. Now, what else can you? What else can you check off? We touch the left eye, only the right eye closed.
The sensory part is okay, I guess.
On which side?
On both sides.
Why? Why right? We didn't touch right. We don't know. Question mark. We don't know. We didn't touch right. But left, yeah.
Mm-hmm.
How the hell did the right eye know to close
Mm-hmm.
when you touch the left eye if the sensory part of the left eye wasn't working? Right.
Right.
So you touch the left eye. If the right eye closed, that means sensory on the left is working. How would it know? It doesn't know unless you felt
Mm-hmm.
it. So what
Mm-hmm.
this clearly tells us is that the motor section of left is out. Now we don't know. We have to actually touch the right eye too to appreciate this, but we've
Mm-hmm.
already got our answer for the test, like what they're gonna ask, right?
Right.
Okay. Let me try a different one. We'll do it again. Left, right. So do sensory motor. Um, you touch the left eye and nothing happens. You touch the right eye and both eyes close. Tell me what you know. Do the motor first. You touch the left eye, nothing happens. You touch the right eye, both eyes close.
So the left eye, the sensor is knocked out.
Left eye, left eye
Sensory.
sensors. You just ran on me. Okay,
Yeah,
so
was it? Yeah.
yeah, you're completely correct. But so
Okay.
yeah, so the yeah, so yeah, you touch the right eye and both eye closed, so you can clearly check the
Yeah.
motors on both, right?
Yeah.
And
Yeah.
then so that's about as hard as they can make it. It's the
Mm-hmm.
same thing with the pupil dilation too. It's the same exact thing.
Right.
If you do uh, shine a light in the left eye and only the right eye constricts,
Yeah.
what do
So
you
the
know?
so the right um right no, the motor is messed up for the right one. No, for the
So
left one.
you
Sorry, my bad.
exactly right,
Mhm.
right. So it was just like this one here. It was
Mhm.
just the same thing as this, but you same thing: pupil constriction, pupil dilation
Mhm.
versus touching and it blinking. Okay, so yeah, that's about as hard as they could make it. So just on your little whiteboard or whatever you got to do, just do
Mhm.
this if you got
Yeah.
to, and just make sure. Just if you have time, just do it. I know you can probably do it in your head. Just don't mess it up because it's
Yeah.
easy
Yeah.
points, right? It's one of those
Right.
things you can actually check yourself on. So just
Yeah.
make sure you got that
Mhm.
straight. Okay, is that everything? Lingual. Oh, what about tell me about shingles.
For shingles, I think that's the one with V2, where the
Okay.
ganglion is, yeah, has like
Yeah.
the
So
virus and stuff.
the
My bad.
picture you saw in your
Mhm.
slides is V2.
Yeah.
What I want you to know is the shingles can live in two places. Where does it generally live that we know about?
Ganglion.
Dorsal root ganglion. Okay. But what about in the face? What ganglion in the face does it live in?
Or trigeminal.
Very good. This is how they can ask the question on the test, right?
Hmm.
Typically, dorsal root ganglion, that's your dermatomal patterns, but it
Okay.
can live in the trigeminal nerve, right? And then you just need to look and see on the face if it's V1, V2, or V3. You'll
Hmm.
see it
Okay.
clearly lined in one, two, or three. Okay, that's good there. Okay, let's also, there also is a branch of set. Actually, there's a branch of both. Is it five? Yes. Okay, there's a branch of both we need to talk about. Okay, the tensor, the tensor tympani, and
Hmm.
the stapedius. Okay,
Yeah.
what are these muscles? Okay, so tensor tympani, they're both motor control. Okay,
Hmm.
what do they do?
I think stapedius is the one that dampens the sound, the loud sounds.
They both do that,
Okay, but I
right?
thought either one, like I think like one was for like low frequency noises, and the other one was
I don't
for
think, yeah, I
no.
don't think they'll make you. Yeah, it helps primarily. I think Stapedius in particular helps primarily with higher pitched sounds.
Hmm.
Um, I don't think you'll need to differentiate.
Okay.
What I want you to know is they help to dampen sound, both of them.
Okay.
Okay. The questions I've seen were all Stapedius questions. I haven't seen really sensor timpani, but I wanted to point that out too. Now, a good test question is patient walks in 3 hours ago, older guy, complete right side of his face palsy.
Hmm.
What other what other nerve injury might you, or what other symptom might you expect?
Hmm.
What if I said hyperacusis?
Yeah.
Now they'll probably just say irritation to loud sounds, right?
Hmm.
But this is the
Right.
word, right? This is inability to dampen sound. So you're
Yeah.
thinking your stapedius muscle, okay? So that
Hmm.
comes off of seven, and so that's helps to dampen sound. So don't forget that one. Okay. uh, one more thing. Let's talk about seven. I don't know if they'll really keep this um, on your test or not. The concept of upper spares upper. Do you remember reading about that?
Yep. Yep.
Okay.
The
So if
the
we were
upper
talking,
motor. Yeah.
yeah, you
Yeah.
can go ahead. Go ahead.
Yeah, so I was just saying, like the so if there's a lesion on the upper side, like let's say the brain cortex side, it spares the upper part of the face, something like that.
Yeah, that's
Yeah.
exactly right. Um, so when we talk about, well, all cranial nerves, are they upper or lower motor neurons?
Lower.
They're all considered lower motor neurons. So they're all ipsilateral,
Hmm.
all your cranial nerves. So when they're talking about this facial palsy, they're talking about cranial nerve 7, right? This lower motor neuron
Hmm.
problem. Okay,
Right.
so complete face. If it was an upper motor neuron, like coming from the brain, it will spare the forehead. You'll learn about why later. Okay, so
Hmm.
the question would
Okay.
be more lower motor neuron for this test because you talked about cranial nerve 7. Okay, that was pretty good. I think we kind of covered everything there. 7, we go. All right. So first, before we move on to 8, I always like to say that 7 and 8 travel together, right?
Hmm. Right.
Internal acoustic meatus.
Hmm.
I like to include this because sometimes they talk about a tumor of 8 that's
Hmm.
called an acoustic schwannoma, or any
Okay.
sort of impingement of 8. You're worried about if they start talking about symptoms of balance or balance problems or
Hmm.
hearing problems.
Hmm.
Also worry about that proximity to 7, okay? Because it
Okay.
can also end up, because of their proximity, end up having facial problems, okay?
Hmm.
So
Hmm.
what is cranial nerve 8?
It's called vestibular cochlear. So,
Okay, so
um,
what's the first part?
vestibule is the one for balance.
Balance, right? So that's
Yeah.
balance. And then cochlear is for hearing.
Right.
Oops, cochlear. All right, for hearing.
Hmm.
Okay, I want to show you a specific picture from
Hmm.
your notes real quick. Let's go. Let me share my screen. It was from uh, Solid. All right, look at this. Okay, appreciate here. So this is our internal acoustic meatus. So eight's going to come in through here. I really like this as a test question. I would, if I was a teacher, I would put this.
Hmm.
This would be my test question. So appreciate this. Sound comes in through here. This is your ear, right? Sound's coming in.
Hmm.
Tympanic membrane right here. Sound hits this like a drum, right? You have
Right.
the bones right here that are touching it. They all
Hmm.
move and press. You can't see the stapes. Malleus
Hmm.
Inca, you can't see the stapes. They
Okay.
press right here. It presses the fluid, right? In the inner ear.
Hmm.
Now you're in the inner ear. I like this as a test question because you can clearly see 8 splitting. You should be able to look at this and clearly say that is a cross section of the cochlea,
Hmm.
right? It's
Hmm.
your spiral, right?
Right.
So if you can identify that, then if I was a teacher, I would say, what is this nerve? Right? That's
Hmm.
all I would say. I would say, okay, now you need to orient yourself. I would hope that you could say that's the cochlea. So this is the point where the vestibular nerve and the cochlear nerve split,
Hmm.
right? Okay.
Right.
So I like that as a test question. Um, thought I'd share, but I want to show you something else in this one while we have it up. Um, Look at this one. I think this will be on your test as well. So the scala vestibuli perilymph, the scala tympani perilymph. Okay.
Mm-hmm. Yep.
Scala media, that's where our endolymph is.
Mm-hmm. Okay.
Don't forget why they like this. I don't know, but they like you to know that endolymph is similar to intracellular fluid, implying high potassium.
Mm. Okay.
Okay. Endolymph. Endolymph, like intracellular fluid, high potassium. Perilymph, kind of like extracellular fluid, meaning high sodium. Okay. Fun fact. And they throw it on there. Okay. What I want you to know, I want you to know one more thing. This
Mm-hmm.
endolymph is made conveniently right here. This is called the stria vascularis, okay? The stria vascularis. If they ask you where the endolymph is made,
Mm-hmm.
it's made in the stria vascularis. It's stored or presented into the media, but it's made in the stria vascularis.
Mm-hmm.
Okay. So that's what I think they would ask you in relation to that. Let me see. Let me show you something since I have this histology of the eye. Um, all right. You definitely need to know the layers of the retina. Okay. Appreciate light comes in this way. Light is going through the eyeball, through the vitreous humor, to the back of the eye and hitting the eye here first. Okay, so it goes this way. You get, this is a test question, retinal detachment in between layers 1 and 2. There's no true basement membrane. If you had a basement membrane, it would scatter the light. So this is kind of finely pressed against the backside of the eye. Okay. So it's very, if you get some sort of suction injury of the eye, you can have a retinal detachment between layers 1 and 2. I would know all the layers. I would know what they look like just so they don't get you. The nuclear layers have nuclei in them. The ganglion layers look like they have kind of extensions off the nuclei, right? So that would know that. Now, the last thing here, just at the bottom, I've seen questions. Central retinal covers all of these arteries, 6 through 10. The choriocapillary layer of the chorioid, which is under here, the chorioid, will supply the blood to layers 1 through 5 from the bottom side. Okay. But all fair game questions. One more thing. They had like a more just, okay. Yeah, this one. So this is looking at the cornea, the outside, right? Remember, it's avascular. It will get blood supply from the actual air. This is the anterior chamber, and then this is the lens. Layer 3 here, that is the entire retina. Okay. This is the choroid. 4 is the choroid. So that's going to supply blood to layers 1 through 5, right? Excuse me, the choroid is going to be underneath, so it's going to supply layers, the bottom layers. Now let me just double check. Yeah, the choroid is going to give it to 1 through 5. Yes, bottom layers, right? So the light's coming through this way. The choroid is going to supply 1 through 5, and then you see your sclera on the outside. That's the white part. Okay. So definitely know this slide as well. It's fair game. Okay.
Like how important is the anatomy for this exam?
Well, yeah, I mean, the anatomy is fairly important. We'll go through the foramen and stuff like that, and we'll go through the cranial nerves in a second once we finish these. And which I'll try to go through some of the anatomy stuff. Okay, so vestibular, cochlear, balance, and hearing. We kind of talked about how that system works.
Mhm.
Okay, 9 and 10, motor or sensory?
Um, both.
Very good. Yes,
Yeah.
both. So we're thinking, yeah, like the palate, right?
Hmm.
Okay,
Yeah.
so there's one big exception that 9 does for motor. Do you know what the muscle is?
Is that the palatoglossal one?
It's the
Stylogloss.
stylopharyngeus.
Okay, stylopharyngeus.
So think glossopharyngeus, stylopharyngeus, glossopharyngeus nerve, stylopharyngeus muscle.
Yeah. Hmm.
Us. Okay, so um, the sorry. So the vagus nerve is going to do all the muscles of the larynx except one, the
Hmm.
stylopharyngeus. 9 does that. Great. So that's a great test question, right?
Right.
Okay, let's talk about some of the differences in 10. Okay, so 10 has two major branches, the superior laryngeal and the recurrent laryngeal. Okay, now the superior laryngeal doesn't really matter. It has two branches, the
Hmm.
external and the internal branch. Now, do you know what there's a specific muscle that the external branch does?
Yeah, I'm not sure because I didn't. I like.
Okay.
I didn't go over it, but it was
Okay.
just.
So it's the cricothyroid
Mm-hmm.
muscle. Now, again, just like 9 has this exception to stylopharyngeus muscle, the external branch here, the external laryngeal branch has a dedicated muscle, the cricothyroid muscle.
Hmm.
Okay, so that's very specific. Now, the internal branch, we need to move over to the sensory component. Okay, so the way I like to do this is by separating it by the vocal cords. Okay,
Okay.
the internal branch coming off the superior laryngeal, coming off of the vagus, does all sensory above the vocal cords.
Hmm.
Okay, sensory above. Sensory below the vocal cords is recurrent
Hmm. Okay.
laryngeal. So recurrent laryngeal is very important. It does all the sensory below the vocal cords and all the muscles except the cricothyroid,
Hmm.
except this one, right? So let me just say it again. So 10, the motor portion of 10, 10 is going to have two branches, superior laryngeal and the recurrent laryngeal. The
Hmm.
superior laryngeal is going to have two branches you need to know, the external and the internal laryngeal. The external laryngeal does the cricothyroid muscle. The internal laryngeal does sensory above the vocal cords. The recurrent laryngeal does sensory below the vocal cords and all the other muscles. So again, when you're writing test questions, here's a major exception for 9.
Hmm.
Here's a major exception for a branch of 10. All right. They ask you about masses on the vocal cords or whatnot, sensory innervation here. Okay. Now let's talk about the reflex. Here we have the gag reflex.
Hmm.
So we do it again, sensory and motor. Um, so what is the sensory component of the gag reflex?
Sensory is 9.
9.
Hmm.
And what's the motor component?
10.
10. Okay. In case they ask the cough reflex, what is
Yeah.
the component of that? What is the
Both are 10.
both of 10?
Hmm.
Okay, very good. And then lastly, there is 11 and 12. Are those motor or sensory?
Uh, I think both.
Those are going to be motor.
Motor motor. Okay.
Okay. So 11 does two muscles. What two muscles?
Oh, the sternocleidomastoid and trapezius.
Okay. So this trapezius will help you shrug your shoulders.
Hmm.
The sternocleidomastoid will help you turn your head. Now, be careful of the exception. If the patient cannot turn their head to the right, what sternocleidomastoid is injured?
Left.
Left. So
Mhm.
what cranial nerve is injured?
11.
Left 11,
Left
right?
11.
Okay,
Right.
so yeah, the left
Hmm.
sternocleidomastoid turns the head to the right. The right sternocleidomastoid turns the head to the left.
Hmm.
Um, okay, so that's 11. And then what does 12 do? All the muscles of the tongue, right?
Hmm.
What's the specific muscle that sticks the tongue out?
Yeah. I don't know.
It's the genioglossus, is what it's called.
Genioglossus. Okay.
Okay, yeah.
Hmm.
Okay, so that's that. Okay, so let's go over some of the anatomy stuff.
So,
Let's talk about the anatomy, the foramen. Okay, so superior orbital fissure. What's going to go through there?
SOF is 3, 4, V1, 6.
I like to do it like this: six
Okay.
and then V1 because I do the rest in order. Then I
Okay.
do rotundum, ovale, spinosum,
Hmm.
ROS. So I just go in order.
Hmm.
So I did
Right.
3, 4, 6, V1. Rotundum is what?
V2,
V2.
and
Ovale would be
V3.
V3. And don't forget what goes through the spinosum.
MMA, the middle
Yeah, very
meningeal.
good.
Yeah.
Middle meningeal. And what injury are we worried about with that?
The middle meningeal, that was the epidural hemorrhage.
Yeah, epidural hematomas. Yeah, good.
Yeah.
So the younger guy gets hit on the side of the head, has a lucid interval, and then has maybe an uncle herniation. And again, herniations, you're worried about cranial nerve 3. Eye will
Hmm.
be down and out, ptosis, and the levator palpebrae, and the eye will be dilated.
Okay.
Okay, what's next? Internal acoustic meatus. What goes through there?
7 and 8.
Very good. All right. Then we have our jugular foramen. What
9th and
goes through
11.
there? 9 and 11. Hypoglossal canal. What goes through there? All by
12.
itself. 12.
Yeah.
Perfect. Okay.
Hmm.
Now there's another one we should know. The cavernous sinus. What
Hmm.
goes through there?
I think 3, 4, 6, V1 and V2.
Very good.
Yeah.
I
Okay.
was
I
going to
was
try to
like,
catch.
wait.
I
Yeah,
was
what
going
V2?
to catch you on that one. So watch. This was a question I saw. Patient had a recent infection. Sorry, I'm not doing that on purpose. My camera's messed
That's
up.
okay. Yeah.
It'll pop back on. Yeah.
Yeah.
So a patient has a recent infection of the face. Okay.
Hmm.
Now all of a sudden has a fever. All of a sudden doesn't have any sensation to the forehead or to the maxilla. Okay. And they
Hmm.
said, where is the problem? Now, my first question is, could it be the superior orbital fissure?
No,
Why is that?
because there's no like SL4 does not have V2, so sensation over here is
Yeah,
messed up.
exactly, right. And that's kind of how they'll phrase your question. So if the questions get very cumbersome and
Hmm.
start talking about a bunch of different symptoms, all you have to do, well, not all you have to do, but the goal is to write down what branches you're talking about. So if they say you have both forehead and sensory loss and maxillary sensory loss, I mean, I've got to include both of those. So the SO4
Hmm.
is out. So this would be where I would lean. And then you would say, well, does it make sense that the patient would get a fever, maybe meningitis, maybe even sepsis? Yeah, sure, if it goes into the cavernous sinus. Sure. Okay. So very good. So that's some of the anatomy there.